Welcome to the plume demonstration video. Over the past few years, salbutamol inhalers were re-engineered in order to be used with HFA propellant, but because not all salbutamol inhalers were redesigned exactly the same way, there are now differences between them, differences that should be considered and discussed with patients. Important points of difference include the characteristics of the plume. Generally, it's more desirable to have a warmer plume temperature and a lower impact force. Additionally, the duration of the plume determines the length of time patients have to breathe in the medication. This reenactment demonstrates the difference between Salamol HFA plume and Ventolin HFA plume. At the onset of this demonstration, the authenticity of both Ventolin HFA and Salamol HFA inhalers were confirmed by NextBreathe LLC and an independent source. In order to minimize variables, both Ventolin HFA and Salamol HFA inhalers in this demonstration were used and maintained at room temperature. Immediately before the demonstration, each inhaler were shaken and primed according to the instructions in their respective package inserts. Let's begin the demonstration by first observing the plume generated by Ventolin HFA inhaler. Note that the plume provided Ventolin HFA has an appropriate mean minimal temperature of -35.9 Celsius and a mean force of 0.0759 newtons. Additionally, the duration of the plume that Ventolin HFA provides is 156.10 milliseconds. Next, let's observe the plume generated by Salamol HFA inhaler. Note that the plume provided by Salamol HFA has an appropriate mean minimal temperature of 7.2 Celsius and a mean force of 0.0336 newtons. Additionally, the duration of the plume that Salamol HFA provides is 384.68 milliseconds. Now, let's compare both plumes. As you can see, there was a demonstrable difference between the Salamol HFA and the Ventolin HFA plumes. Specifically, the plume that Salamol HFA provides is over than 43 degrees warmer, lasts nearly 2.5 times longer, and 55% less forceful than the plume Ventolin HFA provides. These differences may be important to your patients. What advantages could these differences provide? The warm, low-impact plume that Salamol HFA provides reduces the cold, forceful blast effect and minimizes the likelihood that patients involuntarily pause inhalation. Additionally, the longer duration plume may also be more forgiving for those who have poor inhaler techniques. So when you are prescribing a rescue inhaler for your patients with asthma, exercise-induced bronchospasm, or COPD, write for Salamol HFA, the inhaler designed to deliver more than salbutamol. With Salamol HFA, the difference is in the design.